Imagine a world where you walk into a hospital and there is not even enough nurses to take care of the patients. Unfortunately, this is not a distant reality. It is happening now. Nurses are leaving healthcare at an alarming rate, and this is putting healthcare in a crisis mode. Well, most of the time they're in a crisis mode. But why is this happening? Why are nurses leaving healthcare? Let's break it down. Hi, my name is Dion, and I'm a new graduate nurse. Being a new graduate nurse, it has allowed me to see the first and challenges faced by nurses on a daily. In this video, we're diving into top reasons why the nurses are leaving their jobs, the impact on healthcare, and possible solution to this growing problem. So the reality is let's start with the statistics. Did you know that over 100,000 nurses left the workforce in 2023 alone? Over 100,000. Imagine that. This trend has been escalated as the years going by, and even during the pandemic, things was worst. So it is very alarming. And even though you have a lot of nurses who are in school, when they graduate and join the sector, things are seemingly becoming reality to them or realistic. So it's not what they dream of. And so this also helps them to leave. When nurses leave, it doesn't just affect hospital. It affects you, it affects your loved one, and the entire healthcare system. Patients face a longer wait time, fewer resources, and higher risk of medical errors. Think about that. When you have reduced nurses, not a lot of nurses to patient ratios the are high. Like you would have like one nurse for 7 or 8 patients. Um, that can cause a lot of medical errors. You know, so and you're gonna have longer waiting time in the hospital, which is also a risk to your life and their family life. Why are nurses quitting? Nurses are quitting because of many, many reasons. One, you have burnout and stress. Nurses work 12 to 16 hour shift regularly, often without breaks. Add to the emotional toll of caring for patients, and it's no wonder burnout is rampant. It's it's a lot. Believe me, it is a lot. There's also inadequate staff in many hospitals are short staff, are always short staff. And then sometimes I look, I'm like, they're hiring, where are they hiring? But more they hire, more they're short. That's because the turnover rate is very high. So many hospitals are short staffed, facing one nurses to care for 6 to 10 patients, when the safety ratio should be closer to one nurse to 4 patients. That will give us adequate time to monitor a patient's health, monitor them, sit and talk to them, find out what is happening, how are they feeling whilst they're being treated with the medications and so forth, and to have a better insight of what is going on with our patients. However, the ratio 6 to 10 does not allow us to allow us that autonomy to be able to do such thing. In my experience, this compromises patients' care and put unnecessary pressure on us, the nurses. Let's look at something else. We're getting low pay. and very poor benefits. Despite the demanding work, many nurses feel underpaid compared to professions with similar stress level, right? It's like nurses are not even, it's like we are not even valued. We are definitely not valued. And this will reflect on certain places that we work and also management, poor management. And believe me, I'm gonna, this next subheading that I'm gonna talk about, it happens so often, and this is workplace violence. Nurses are on the front line of aggression, with over 70% reporting verbal or physical abuse from patients, visitors, and even their own co workers, other nurses. COVID-19 has a lasting impact, and the pandemic stretched nurses to their limits mentally and physically and emotionally. For many, it was the breaking point. And so you have a lot of people who leave the healthcare, and not only nurses, but even CNAs and other part of the healthcare sector, especially if they did have direct, if they were doing direct care, you know, with the patients during COVID. COVID has shown a lot of people a lot of things. I mean, I wasn't a nurse during COVID, but I was a CNA. I was working in the hospital, and I can tell you, it was dreadful. Um, I remember a coworker of mine, right? We did graduate school, and I'm telling you, we're new nurses, and she really did love nursing, but after the stress and the problem in this little short time and short space, she just decided to quit. And please leave your comments down at the bottom and let me know if you know of anyone that quit and what did they say was the main reason why they quit nursing. That nurse, she said she wants to help people, but she can't pour out from an empty cup because she feel empty, and this is a reality for many nurses. Please comment below of anyone that you know that were nurses or even healthcare workers that left the healthcare because of what I'm talking about. Now, what can be done? We're saying for employers, hospitals need to improve staffing ratios, offer competitive pays, and prioritize mental health of their staff. But is that enough? Increasing or improving on the staff ratios also mean that you need to get qualified staff who will reflect the organization culture and not their own culture. And when I look on certain city hospital, these hospital hires people, like 90% of these hospitals, or 90% of, let me clarify that. All right. When I look at the city hospitals, it would seem as if each of them hire one set of people who are from one place. And so instead of these people working to reflect the culture of the hospital, it more seems as if the hospital is operating in the culture of these people. And so there will be new people that come to join the entity that are faced with aggression because they're not from the place that these people are from. Please comment below if you understand what I'm saying. And this is something that I will be going deeper in, but tonight we will have just a little short preview of what is to come on this channel, because I will only be talking facts, and there's gonna be some times and I'll be taking on nurses, you know, just people, just please subscribe, like, share the video to your friends, your family, people who you know work in healthcare, because this is going to be a channel, or this is a channel that I will be discussing facts, things that I've seen, things that have happened, and ways how I think that the system or the healthcare can be improved. So as I said, hospitals need to improve staffing ratios and offer competitive pays and prioritize our mental health, and also support the staff. Um, but as I said, improving staff ratio, that's just not enough. And we are going to delve further in it in another post. Um, but let's look at competitive pay. What are competitive pay? What is competitive pay per se? City Hospital has just brought up their ratio, what they're paying. They just bring it up, trying to be in the competition of the private sector hospitals. The private sector hospitals are pretty much getting their pay, but in some of them, the hostility from the nurses and the hostile environment that you have to go through, it's horrible. And it's basically the same in the city hospital with a lower pay. So imagine working in the city hospital that you think you would have some comfort, but they have hired a set of people that has somewhat established their culture from where they're from within the entity. And so it makes the hospital hostile. So you go in there to work for a lesser pay to come out with mental illness, or, some form of PTSD, or, some form of problems. Imagine that. And it's not nice. It's definitely not nice. But I will get further into this. Just subscribe to my channel. Subscribe so we can have sufficient subscribers. And I think I'm having some allergy problem. I'm gonna drink me some garlic tea. Um, Subscribe to my channels, and we will have further discussion on this, because I can tell you that, listen, it is a lot in healthcare. It is a lot. Um, if you're struggling though as a nurse, please seek support. There are organizations and network dedicated to helping nurses manage burnout and stress. Please seek support, nurses. Please, I beg you. Also, let us recap on the points that nurses are quitting because of burnout, low pay, poor staffing, and violence, workplace violence. This isn't just nurses' problem; it's a entire healthcare problem. We need to act now to support the people who care for us. To every nurse is watching, you are valued, and you are needed, and you deserve better. Let's work together to create a system that supports us, right? What do you think? Are you a nurse experiencing these challenges? Or do you know someone who is? Share your thoughts in the comments below. I'd love to hear from you. If you found this video insightful, please like, subscribe, and share it with others. Let's spread awareness and start the conversation. Okay? Thank you very much. Have a good night, everybody. See you in the next vlog.